Oh,
It's painful.
oh, it is painful.
But it felt better, right?
Yeah.
Yeah. Okay. My name is Akil Moladina. I'm a chiropractor here in Calgary, Alberta, and I provide dry needling and medical acupuncture services to my patients. I have been practicing now for about 5 years, and I love treating these patients because I'm really good with my hands and I like to, really help and make a difference. I chose to learn dry needling as a chiropractor because it helps the patient get there much quicker. When I put needles into them, they respond in a much quicker fashion and the muscles loosen up pretty much immediately. So that same response that you're getting from another chiropractor through adjustments and other work might take them 4 or 5 or 6 visits. I can get there in 1, 2, or 3. So it gets them there much quicker, even though it's a little painful, but it's worth it for the end goal. Dry needling is where we take a needle and we put it into the muscular part of the muscle, so the really beefy part. And when you hit that part, what you're looking for is to cause a chemical change to that muscle. So we're really close to that musculotendinous junction. So when you hit that area, the muscle is going to twitch and respond. So far, there's 3 types of acupuncture that we talk about. There's traditional Chinese acupuncture, there's medical acupuncture, which is what I'm trained in, and there's also dry needling, which I'm also trained in. So traditional Chinese acupuncture is when you take a needle, usually a smaller one. So if I was going to show you a smaller needle, you only go in about that much into the skin, not fully into the muscle. Then the needles I usually work with, we go a little bit longer. So this is about 5 centimeters. This is more for dry needling because we want to go deeper into the muscle and you want to create a response in that muscle. And then for the medical acupuncture, we use an even bigger needle. So this one's 7.5 centimeters, and I usually go up to either 10 or 12.5 centimeters because it makes that much of a difference. We have to get deeper and we can stimulate nerves. So definitely much deeper than what other needling techniques use. And with the functional medical acupuncture, I'm stimulating with electricity. So if you're having any types of nerve damage or nerve problems, numbness, tingling, whatever it might be, we can put a needle into that nerve right beside it and stimulate with some electricity, where I have 2 different types of electricity that I use as well, which this one is our Pointer Plus. So more specific because I can do it 1 needle at a time. So I put a needle in and I can stimulate nerve. It's too much? You can see your whole foot move. I also have this TENS machine. So it works very well and it has those little banana clips on the end. So you can attach it to needles and then you can turn it on and stimulate similar to any other TENS machine. But this one is with the needle, so you get much deeper and you can stimulate nerves. Needling is recognized by all medical communities. It's a very good treatment option for multiple injuries, such as tennis elbow, low back pain, neck pain, shoulder pain. It depends on what you're trying to work on, but it's recognized by all medical associations and all insurances. Majority of the time we bill under a chiropractor here, and dry needling is included in our treatment. But there are certain insurance companies that take acupuncture as a treatment option and have more benefits for that as well. Of course, if someone has had past trauma with needles or different issues, then maybe we step away from the needle and we don't do it. But there is a point where some patients really want to get through it. So if you can just talk to them and make them feel comfortable, then we can work through the needling, and I can always start off lighter and then work our way up into the more intense needling. There's a lot of research out there for different injuries. One that comes to mind is tennis elbow, because a lot of people deal with it, especially when you're at a desk writing all the time or taking pictures all the time. You deal with elbow pain, right? So of course it's painful when I do the needling, but no pain, no gain.